Anybody who's worried about another person who's experiencing some of these things doesn't need to diagnose or know exactly what's going on. We have a good sense of if something is wrong. And so, and I encourage people to act on that sort of gut feeling. So some of the things you may be looking for is changes in behavior. So maybe this person used to be very neat and punctual, and now when you see them, they're disheveled, they're late. Maybe they were outgoing and now they go into their office and close the door and stay in there. Those may be some small hints of what's going on. There can be statements that can be made around how they're feeling, being particularly depressed or withdrawn or angry. And again, things that are a change from what they normally are relating to people. And the other things, some of the more, I think standard things we would think of would be maybe smelling alcohol on their breath, maybe seeing some slurred speech or stumbling. And again, if you really think about it, a lot of these things could be attributed to a variety of factors. And we're not saying that you need to be an expert on any of this, but you know this person and you know that there's something wrong, and call. And you can call TLAP. It's confidential. And in fact, if you're simply worried about somebody and want to just talk this through and see if there's cause for concern, you can call us anonymously. We're not going to do an intake with you. We don't need to know your bar number or your name. We want to help, and we are there to help and want to talk you through that. So you can call, talk to us about that, get some tips and some ideas. And hopefully we can figure out what's going on and what's a good way to go from there. The greatest thing that the bar is dealing with right now in regards to substance use disorders and mental health disorders is the stigma and the shame that surrounds these things. And because of that, the fear and the unwillingness of lawyers to ask for help. And only when we start talking about these things are we going to be able to reduce some of that stigma and start to find some solutions.